We want people in Africa to climb the ladder of prosperity. But of course, when the bottom rungs of that ladder are broken by disease and preventable death on a massive scale, when countries can't even get on the bottom rung of the growth ladder because 1 in 7 of their children die before they reach their 5th birthday, we have to take urgent action. We have to save lives, and then we can help people to live. So that's where today's announcement fits in, because there cannot really be any effective development, economic or political, while there are still millions of people dying unnecessarily.
Let's talk to Helen Evans, Chief Executive of the Global Alliance for Vaccines and Immunisations, who's going to tell me, first of all, Helen, I'm sure, whether it's Gavi or Gavi, just so we all know.
It's Gavi. It's
Gavi.
How you pronounce it.
Thank you.
It's the Global Alliance for Vaccines and Gavi.
Now, in terms of $4 billion for 250 million children, it's great to have that sort of money, but it works out at what, roughly $16 a head. Is that enough?
I think there are still, every year, 2 million children die of vaccine-preventable diseases. And we set ourselves a target of raising $3.7 billion, which would allow us to immunise 240 million children and potentially save 4 million lives. But there are more children who are unvaccinated. So the more money we get, obviously the more vaccines we can buy and the more children that can be vaccinated and saved from these diseases that children in developed countries never see, and parents in developed countries don't see because their children are routinely immunised.
Well, what sort of vaccinations would I or my children have got that they will now be getting?
Well, there are what are called the basic 5 vaccinations. That's in pentavalent vaccine. That's for pertussis, which is whooping cough, diphtheria, for Haemophilus influenza, for hepatitis B. Your children would have got all of those immunisations. They come in a 5-valent vaccine. But many children in developing countries don't have them at all. And more than that, so they get sick from these diseases. They also then don't have access to the health services that we're so accustomed to. If yours or my child gets sick, we take them to the doctor, and if they get really sick, we take them into the hospital and they go into intensive care. But in developing countries, children simply die very often. That is 1 child every 20 seconds dies of a vaccine-preventable disease.
One of the great difficulties I know is not just getting the vaccinations to these communities, but then persuading the people in those communities that it's the right thing to do.
I'm sorry, I didn't get the question.
You've got another task on your hand once you get to these remote places, in then persuading people that they should have this.
No, I don't think persuading people that they should have the vaccines in developing countries is a problem at all. I've been to many communities where the mothers are all coming in anxious to get the vaccines. At a recent launch, for instance, of a pneumococcal vaccine, which is a new, very powerful vaccine that Gavi is now funding, that's perhaps the biggest killer of children under 5. When we launched that in Nairobi, I went to the clinics the next day and the women were pouring in because they were well aware that the vaccine was available, and many of them had lost children to pneumonia, but they simply couldn't afford it and the public clinic couldn't afford it. And so they were flocking in. So I don't think actually getting the parents to have their children immunised is the issue. Well, I think the first challenge we have is to actually get the vaccines there.
Yeah, good for me to be proved wrong there in that case. Helen, thanks very much. I just wanted to ask you about one thing. Drugs companies have brought their costs down enormously. That makes this workable. But was it a bit of a shame that they didn't do so earlier?
Well, I think you're absolutely right. The cost of the vaccines is a big issue. The cheaper the vaccines, the more that the Gavi Alliance can pay for. But perhaps as importantly, the more developing countries themselves are likely to be able to afford to purchase them and continue to purchase them. I think that some manufacturers have been committed to bringing prices down or making prices available at a lower price in developing countries for some time. For instance, the Serum Institute of India has always had a policy have a very philanthropic approach of providing vaccines at lower cost. But the big multinational pharmaceutical companies are really now coming on board in a very impressive way and have made a very strong commitment to tiered pricing, and a very strong commitment. Andrew Whitty of GSK has made a very strong commitment that he feels that all children, no matter where they live, should have access to these vaccines. And if that means lowering the prices, providing them at a lower price for developing countries, then that's what they're prepared to do. So, yes, we've still got a way to go, but I think it's progress.
We wish you the very best of luck. Helen Evans, thank you very much indeed.